GBMC Healthcare.
Did you know that roughly 8 out of 10 Americans will experience back pain in their lives?
And according to the CDC, over 50,000 people a year will have a back injury in the winter. Well, here to help prevent us from becoming another statistic is Dr. Bimal Rami from GBMC. Welcome.
Thank you. Thank you for having me.
All right, so talk to us. Are cold temperatures usually associated with an increased risk of back injuries, and if so, why?
Well, back injuries are present throughout the year, but I think during the winter months when people are less active, they can be more common.
Okay, makes sense.
Yeah, and along with that, the activity that we engage in during the holidays, like shopping and decorating and all the snow shoveling and things like that, can increase the risk of injury.
We're moving around a lot more, especially during the December months. So what kind of injuries can result from maybe falling on your back?
Yeah, falls are particularly bothersome in snow and ice. You can get fractures. In worst case scenarios, you can get fractures or a disc herniation. But most commonly what we see is sprains and strains.
All right, so what are the most notable causes? I think you mentioned some for injury during these winter months.
Yeah, I think the most notable causes that bring somebody to the emergency room, for example, is lifting heavy suitcases when you're going to the airport, or even shoveling or lifting snow during the winter months. Also, when you're decorating, there's falls, there's prone to falls while you're decorating outside or inside the house.
Okay, so can you provide any helpful tips on how to prevent these injuries?
Yeah, I think the best advice I can give somebody is to stay active and try to warm up if you can. For example, if you're about to go out and shovel some heavy snow, you should do a little bit of warm-up exercises before you get out there. Get your heart rate up, get your muscles warmed up, and then go out there. Along with that, you want to try to break up that activity as much as possible. Be it shoveling snow or decorating, try to break it up, take a break once in a while just to give your body some time to relax.
A little hot cocoa in between the shovels, I think we can all get down with that.
Can't hurt.
You need to tell the men that especially, right?
Yes.
You know, family's over, they're like, I got it. Okay, so let's say that somebody does get hurt. Okay, so then how do they know when it is serious and when they should be talking surgery?
Right, that's a good question because most of the time these things are sprains or bruises and they get better within 7 to 10 days.
Okay.
The time to get worried is if the pain, number one, does not resolve within 7 to 10 days, or if the pain starts to shoot down the legs or cause weakness. Those are the real episodes where you want to seek medical advice.
Okay, so where can we go for more information if we feel like we need to know how to prevent all this, or if we feel like we might need your services?
Absolutely, yeah. There's lots of websites. At our website, there's a link that you can look at. We'll go over some of the risks of injuries and things like that. You can also make an appointment to see us in the office if you feel the need.
All right, all that information there on our screen. Dr. Rami, thank you again for being here with us as always. Great tips.
Thank you very much.
You guys be safe out there, and we'll be back.